So the challenges was one, there were increased workload to the healthcare providers, especially in providing comprehensive care services. There was also a lot of work in retrieving services, retrieving files for patients so that it's available for providers. The other challenge which was there was because there is use of, when you use paperwork, you are using a lot of resources in buying papers and all other related things, files and all those things. They came up with the idea of electronic medical records, which later on they had now to evaluate which facilities would require such kind of a service as a startup, probably. Now they had to involve the high volume facilities. They identified those facilities which had quite a large number of clients, and did a pilot, some kind of a pilot, and involved them, conducted the possible infrastructures that were required for the system, and even conducted the possible requirements for manpower, and eventually a series of trainings were undertaken, and some members from the Palidam came and installed the computers, the IQ care system, and after the training, it's when some OGT meetings continued within the facilities. Now that's where the transformation started. Providers were able to efficiently provide service by concentrating on managing the patient, other than previously then they used to concentrate a lot in the paperwork, and they are able now to record and document efficiently. They were also able to report promptly at the end of the month, because the system auto-generates reports, so you don't have to go back and do retrieval of data. It auto-generates in itself. So you have reports at the end of, or at any time you want. In service delivery, there was now efficient. Patients needed not to wait for long so that they are attended, because maybe files are being retrieved or information is being retrieved. It is there at a glance in the desktop. Also helped to reduce, to cut costs in terms of purchasing files, purchasing papers for continuous updating the information in the file. So you no longer buy files, we no longer buy papers, because you already have all the information in the system. So in a way, it cuts the cost for the department also, and making those resources which you are supposed to use for files and all others available for use of other things. EMR tends to reduce a lot of workload to the clinicians, and it also reduces the waiting time of the clients, and it tends to efficiently and accurately input to the client, in an essence that it is difficult for a clinician to overlook any action that is supposed to be undertaken to the client. So it has also reduced errors that used to occur in documentation, and confidentiality issues. Nowadays, it's only those people, those clinicians who handle the IQ care, who can access the patient information. Initially, it was just to send anybody to go and pick or rather retrieve the file, whereby somebody could just open the file and see what is happening to the client. Counties need to invest in the EMR because of the benefits which comes with it, and at the long run it also cuts cost in a way, because you don't have to buy papers, you don't have to buy all those things, and you have your information available for decision making.